Dr. Greeny here. You guys should be excited because today I'm going to literally give you a full skincare routine for acne, morning, night, and plus we're going to talk about some bonus acne products and I'll give you my thoughts on those. Acne sucks. We all deal with it. Like 90% of people deal with acne at some point in their life, and there are a million products out there. So it's important to find out which ones actually work, which ones aren't worth it. So that's what we're going to do today. These tips may not save you from seeing a dermatologist, but it's certainly going to be a dang good start. For those of you who don't know me, I'm Dr. Dylan Greeny. I'm a dermatologist that practices medical, surgical, and cosmetic dermatology. Let's start with 4 acne expectations to know about. When we're treating acne, we have to treat the entire face. We have to do this because we know how acne works. Acne basically is a pore getting blocked, oil building up behind that pore, and then normal skin bacterium called CUTIBACTERIUM, even though it isn't that cute, metabolizes the oil, causing irritation and inflammation. Given that we don't know where this next pore blockage is going to occur, we need to treat all of the skin on our face to try to prevent any new blockage from forming. This pore blockage actually takes a while, so an acne bump may start forming 6 weeks before you ever see a bump on the skin. Number 2, you're going to be a little bit dry and irritated. Almost all the acne treatments that we use tend to dry and irritate the skin a little bit. Most of the time your skin gets used to it, but in those first few weeks you may notice a few more breakouts, a little bit more dryness, and a little bit more irritation. That's normal. Number 3, most of the things that we do for acne are not cures for acne, so you're gonna have to continue using this regimen to maintain your results. The only 2 things that are gonna really save you is growing out of your acne, which does happen, or getting on a medicine like isotretinoin, which can be an acne cure permanently. And number 4, it's gonna take some time. None of these acne treatments work really overnight. It's gonna usually take between 8 and 12 weeks of consistent therapy to see a good result from your acne. And at that point, you may just start first noticing improvement, and that's gonna continue to improve over time. And that's not just fluff, those expectations are very important, but let's go ahead and get into the morning skincare routine for acne. There are basically 2 types of really good acne-based cleansers. One of my favorites is benzoyl peroxide. So benzoyl peroxide comes from a variety of different brands. This is Oxy, but I really like Panoxyl. Generally, you're gonna wanna look for one that is 4 or 5%. 10% is okay for the chest and back, but 4 or 5% is going to be a little bit more gentle on the face. You're going to get the same results with less irritation. Sometimes patients come to me and they say, well, I'm allergic to benzoyl peroxide. And at first I was a little bit skeptical, but I did look it up. There is some benzoyl peroxide allergy. Much more common is the irritation and dryness that we talked about before. However, if you do have a benzoyl peroxide allergy, there is another treatment that you can use, and that treatment is salicylic acid. So this is another great acne cleanser. It helps open up pores. It can decrease skin oiliness as well, which is really, really nice. A bunch of different companies make it. They're all varying between usually 0.5 and 2% salicylic acid. Now personally, if I had to pick between benzoyl peroxide and salicylic acid, I would definitely start with the benzoyl peroxide first. Not only does it open up pores, but it also does a nice job of killing acne bacteria. Now pretty much anybody that talks to you about benzoyl peroxide is gonna tell you that it can bleach fabrics. So this can bleach fabrics. The salicylic acid does not bleach fabrics, just so you know. Now you're only gonna use these cleansers 1 time per day. Using them 2 times a day is gonna make you too irritated. So the active acne cleansers, they're really just 2 things to be using in the morning. The other thing is sunscreen. Sunscreen is important because a lot of people with acne are gonna develop dark marks from the acne bumps after the acne bump goes away. Using sunscreen every single day can help fade those dark spots faster. That irritated skin is almost like fresh baby skin. It's very sensitive to the sun and it can stay darker longer if you're exposed to the sun without protection. There are a lot of great sunscreens on the market. SPF 30 sunscreen is the way to go. Ideally, it's going to say oil-free and non-comedogenic on the label. This one's the ELTA MD, which is a really, really nice one. This is the UV sheer. I also like the UV clear. And then this is the ROCHE-POSAY mineral tinted sunscreen, which is the one I'm currently using and really like it. So we got through our morning routine, and that is half of the equation. If you did just that, your acne would probably get a bit better. But before you go ahead and skip through the video into the night routine, I'd love for you to subscribe. I mean, when do you really get such great information from a dermatologist for free? Plus, if you subscribe, I'd love to answer your questions in the comment section below. Now we're on to our bedtime skincare routine. So this is all about being really gentle with our cleansers. So I'm gonna show you a few great gentle cleansers. These don't have active acne fighting ingredients in them. Now I'm gonna show you my favorite one first. This is the CERAVE Cream to Foam Cleanser. It's awesome. I'm convinced that it would work for any skin type. It has amino acids and hyaluronic acid and ceramides that help hold water on the skin and keep it moisturized, so it basically cleanses without stripping. It also will remove makeup, so really a great cleanser for anybody. If you have straight up oily skin, then I would recommend using the CeraVe Foaming Facial Cleanser. This is a really good option. This came out long before the Cream to Foam Cleanser. It's awesome too. It also has niacinamide in it. These are both fragrance free and awesome. Now, if you have particularly dry or sensitive skin, I would recommend using a gentle cleanser like the ROCHE-POSAY TOLERIANE Gentle Hydrating Cleanser. This is a really nice option. Most of these hydrating cleansers aren't going to lather as much, but they still do a really good job cleansing the skin. Now, it's important to let your skin dry for a few minutes before putting on the next medication. Now, this next medication is by far the most important thing that we've talked about in this whole video. And it's a special medicine called a retinoid. It's derived from vitamin A, and what it does is it stops that first issue with acne formation, which is blocking the pore. It makes our skin cells less sticky and allows pores not to become blocked as easily, but it does take time to work. Now, the cool thing was this product was actually only available by prescription in the past. This is the La Roche-Posay EFFACLAR ADAPELINE gel. Now you can get it over the counter without a prescription. So this routine honestly could have been one that you got from your dermatologist when you saw them in the clinic, but now you can get it over the counter. Now, the EFFACLAR ADAPELINE from La Roche-Posay is just one option. This product is also made by Differin or a company called Acne Free, which has a very affordable adapalene. And any of these would be perfectly fine to use as long as you're using one of them. Now, at bedtime, if you already had a prescription retinoid like TRETINOIN, which is what I personally use, then you would be using this at this time. It's important to know if you're using adapalene or TRETINOIN that you don't need to include another retinol product. This is already stronger and better than an over-retinol product could be. 3 important things with the retinoid. You don't want to use too much. Just a pea-sized amount for your entire face will do. Don't use it more than once a day. Using it more frequently won't make it work any faster. It's just going to irritate you more. And finally, like we said, don't use any other retinol products along with it. If you're using a retinoid like adapalene or TRETINOIN, that's all you need. So that'll get you through the morning and night routine, but we're not quite done yet. There are some other products that are available on the market that I wanted to discuss real quick about acne. People are really frustrated with acne, so they're willing to buy anything over the counter thinking that's gonna make their acne clear faster. So let's talk through a couple of those common things you might find at your drugstore. I'll give you my thoughts on them and talk about when it might be appropriate to use them. So first, we're gonna talk about acne spot treatment cream. So this is an example like the succinic acid treatment from Inky List or the EFFACLAR Duo spot treatment from La Roche-Posay. So these are nice options for spot treating acne bumps that are stubborn, or you have that one lone acne breakout, the rest of your skin's pretty controlled and you want to help it heal up a bit faster. Most of these products end up containing salicylic acid or benzoyl peroxide, which are the common actives that we've already talked about before. It has the potential to dry and irritate you a little bit more when you're adding these other active ingredients onto your current skincare routine. Overall, if I was rating acne spot treatment creams in general, I'd give them a B+. Now, the next thing I'm going to talk about is acne pimple patches. Now, this is something I cannot believe people didn't think about sooner. These are hydrocolloid patches, meaning that they absorb excess fluid and inflammation that comes from acne bumps. Now, what this means is that you wear it overnight, and basically when you wake up in the morning, your acne bump can be less red and also smaller because some of that inflammatory fluid got absorbed into the patch overnight. Now, I was skeptical at first, but I use these. They're really, really amazing. Some of these do have active acne-fighting ingredients too. This comes from COSRX, which is a really, really nice acne patch. It's also very affordable. It has the hydrocolloid membrane, but then also it has a little bit of salicylic acid, and it also has some tea tree. So this is a great patch to wear overnight, and you definitely notice an improvement in a pimple basically overnight with this. Again, not a great option for trying to spot treat pimples all over your face, but if you got one lone breakout, throw it on there overnight and you're gonna be really happy when you wake up in the morning. I rate acne patches like this or the one from Peace Out an A+. Awesome addition to any acne routine. 2 more things I want to talk about. The first one is azelaic acid. So this is an awesome over-the-counter acne treatment that you can get. It can help rosacea and acne. It's also safe in pregnancy, and it's a little less irritating than retinoids. So this is something that's antimicrobial and also anti-inflammatory. So if you haven't tolerated retinoids or you're pregnant or breastfeeding, azelaic acid may be the right option for you. Because it's so safe and awesome, I give it an A-. Now, one product we've all heard about for social media, this is niacinamide. This is usually put into routines for anti-aging benefits and lightening dark spots. It also has some active anti-acne fighting properties too. Look for concentrations around 5%. Those are going to do really good for you. They help restore our skin barrier and also help fight acne. So this is another nice addition, especially for somebody with very mild acne or a little bit of oily skin and they want another treatment option. Overall, niacinamide in general, I rate a B-. As a dermatologist, I promise you, if you follow this routine, your acne will get better. I can't promise it's going to be under complete control, and if you're still having trouble after 4 or 5 months, go see your dermatologist. I hope you're as excited as I am to help improve your acne. If you got any questions, feel free to ask below. I appreciate you watching, and we'll see you next week.